Welcome to the CMSC's virtual poster tour. This poster is titled The Effects of Customized Psychoeducation-Based Neurocounseling Interventions on the Coping Flexibility of African American Women with Multiple Sclerosis. I'd like to introduce the presenter, Dr. Whitney McLaughlin. Dr. McLaughlin is Assistant Professor in the Counselor Education Department at St. Bonaventure University. We're going to review some highlights from the poster and discuss the research findings and implications. Welcome, Dr. McLaughlin.
Thank you for having me.
So first I would like to ask you, you've stated that the subject of African American women's coping behavior is a neglected topic in MS. Why do you think that is the case?
Well, it's been a neglected topic in my perspective in MS because for so long the healthcare and the MS community believed that this chronic disease mainly affected Europeans and European Americans. That's why in the MS literature the focus on African Americans in general is very sparse. More specifically, in a 2015 review in the Neurology Journal, researchers found that out of nearly 60,000 published articles on MS, only 113, or about 0.002%, focus on African Americans. And that finding is particularly disturbing since MS tends to have a more aggressive disease course among African Americans compared to other racial ethnic groups in the U.S. And since MS is 3 times more common among African American women than men, this population needs to be a focal point of MS research.
How do you think African American women might differ from other women with MS in terms of coping behaviors or preferred coping techniques?
So dimensions of identity and culture, as we know, have a significant influence on the coping strategies that one uses to respond to stressful situations. So due to their membership in multiple oppressed groups, African American women with multiple sclerosis may be at an increased risk of stress exposure, which can have a significant and negative impact on their MS. When it comes to coping with a chronic disease and or disability, that involves adjusting to the notion of living with a compromised state of health and coping with the idea of making necessary life changes. To address these stressors and more, African American women can engage in a combination of coping strategies. So in sum, I believe African American women with MS may cope with their chronic disease using culturally based cognitive and behavioral strategies such as spirituality and the strong Black woman stereotype in order to help them adjust and then readjust to the various changes and stressors that are associated with having MS compared to other women with MS.
The strong Black women stereotype is interesting because a stereotype has sort of a negative implication, that particular term. Do you think that maybe some of these women might sort of feel pressured to conform to that stereotype?
Oh, yes, absolutely. It's one of those type of ingrained messaging that is commonly found in the African American community, this notion that Black women need to be strong no matter what, they can't show vulnerability, they have to be everything to everyone, they have to take care of the community, they have to take care of their family. And so that can easily be counterproductive when it comes to, taking care of the self and engaging in self-care and doing the things that can promote wellness, because there's this notion that, you have to be superwoman essentially.
Tell me a bit more about the Be Well intervention. Why do you think this intervention is beneficial for people with MS?
So the Be Well intervention stands for the Brain-Based Education and Wellness Program. I developed the program. It's an 8-week intervention that essentially integrates brain health information with coping skills training. And the aim of the program was to use customized interventions to enhance my participants' coping flexibility. Coping flexibility involves what we call evaluation coping and adaptive coping. Evaluation coping is essentially the process of abandoning a coping strategy or strategies that produce undesirable outcomes. And adaptive coping occurs when an individual uses a more effective coping strategy. I believe that this intervention is beneficial for people with MS for 2 reasons. The first reason is because the interventions are customized for wellness education and coping skills training. The second reason I believe this intervention is beneficial is because it provides psychoeducation related to brain-based wellness.
So with regard to the findings of your study, what aspects of that program do you think proved particularly effective in your population?
So based on the findings, the customized interventions were found to be most effective for increasing the evaluation coping and overall coping flexibility across 3 participants, and it was found to be moderately effective for increasing adaptive coping. These interventions were tailored to meet the participants' needs and personal goals, which were established at the outset of the program. And I'll give you an example. I had a participant, we'll call her Aggie. She came in to the program wanting to reduce her stress burden and more specifically reduce what she described as panic attacks. And over the course of the study, over the course of the Be Well interventions, Aggie made favorable gains in evaluating her coping process and using more adaptive strategies. And those gains were maintained even after the treatment was withdrawn. Furthermore, as she progressed in the Be Well program, she was more readily engaged in reframing some of her irrational thoughts, her thinking patterns, without being prompted.
I'd like to ask you, how do you think other healthcare providers might use this tool in patients with MS, and what advice, or a similar tool, and what advice would you have for them?
Other healthcare providers can use this tool as a psychosocial intervention that provides a brain-based approach to wellness. The Be Well interventions can be used to help people with MS identify the areas in their lives that they're having difficulty coping with. The advice I have is to not use, again, that one-size-fits-all approach to help individuals cope with stress. In order to provide culturally competent care, healthcare providers must understand how the individual's identity, culture, and environment all impact the type and degree of stress they experience, as well as the coping resources and strategies that they ultimately use.
Well, this has been a really great discussion, and I really appreciate your taking the time today to review your research. Thank you.
Thank you so much for having me.